Welcome to AAMG channel. Today we are very honored to have our AAMG doctors, internal medicine. Welcome, Dr. Chang.
Hi, Esther. Thank you for your invitation.
You're welcome. And we'd like to ask, what topic would you like to introduce to our audience?
Well, we're going to talk about a very popular topic today, which is dementia.
Can you actually tell us about why this topic is important to our audience?
Sure, yeah. Dementia is very widespread problem nowadays. Just by the estimation, it's about like 35 million of people in America suffering from dementia nowadays. And there's a projection saying that by year 2050, that will be like even more than 2 times people suffer from dementia. That's why we try to concentrate on this topic today and let everybody know about what's causing dementia and what is the prevention of dementia and what are the symptoms we expect from dementia. Let's start off with some interesting photos before we start more complicated description here. Okay, the first photo, we see a very beautiful lady here. Anyone recognize who she is? Okay, you may be right. She is the Prime Minister of United Kingdom, but unfortunately, she already passed away. She was the Prime Minister of UK from 1979 to 1990. Okay, if you missed the first one, I'm sure you recognize this second person here. He is the great president of USA before, and his name is Ronald Reagan. Okay, here comes the Chinese guy. His name is Professor Kao. He was the professor of Chinese University in Hong Kong. And what is the famous about him? He was the winner of Nobel Prize in 2009. He got a reward on physics for that particular Nobel Prize. The reason for that is because he had a great contribution to the fiber optic material, and that is the pioneer of our internet nowadays. So all 3 persons are very famous, and what are in common of them is they all suffer from dementia towards the end of their life. That's very unfortunate. So today I'm going to talk about dementia. Basically, dementia is a disease caused by abnormal changes of the brain cells. The changes, unfortunately, trigger a decline in our brain function a lot. We have different names for dementia in Chinese, in different places like Hong Kong, Taiwan, and China. But in English, it's very simple. We all name it as dementia. How big is the problem, actually? Well, as I mentioned earlier on, there are about 50 million of people suffer from dementia. And by 2050, which is like 30 years later, there will be like 135 million people, much more people will suffer from dementia. The next question you have in mind may be why? Why is that? Medicine is supposed to be getting better. Why are we going backward? We get more people suffer from dementia by that time. Yes, you are partially right, because we are doing great in terms of our medication, in terms of our technology, and people can live longer nowadays. But that is the problem of that, because when people getting older and they get dementia easier. Okay, as you can see the little table there, from 65 to 74 years old, is only about 3% of people has dementia. From 75 to 84, the chance of getting dementia is higher, is 19%. If you're over 85, you got about 1/4 of the chance to get dementia. Is that scary? Yeah, it's getting more scary. When you get older, you try to enjoy your life more, but you may get a disease like dementia that you cannot enjoy your life anymore. And there are some more observation, from the medical point of view, we have noticed the female patients tends to get the dementia more than the male patients. As the same reason, as I mentioned before, because female, they live longer than male in general. So they get a higher chance to get dementia. And also in low and middle income countries, they tend to have more people suffer from dementia. And I will explain the reason behind later on. When we talk about dementia, there are many different types of dementia. And we're going to concentrate on one single type named as Alzheimer's dementia. Alzheimer's disease has about 70% of the total number of dementia cases. It was first described by a German doctor named as Dr. Alzheimer. And he's the first one to name about this disease. And as you can see on the slide here, the one on the left, well, first of all, this is a cross-section of our human brain. It's a simplified one. And the first one on the left, you can see a normal brain. It looks very full and complete. But the one on the right, you can tell it's small in general. The size of the brain compared to the left is much smaller. And it looks like, particularly in certain areas, there are some shrinkage. Instead of one on the left lower corner, if you have good eyes, you can see that is the hippocampus area. And we can talk about that area later on. So, just looking at this cross-section of the human brain, when they do the autopsy, you can see the difference of people with dementia, and the brain definitely looks abnormal. We talk about most, common type of dementia, Alzheimer, and the second most common dementia is vascular dementia. I have a lot of patients who suffer from stroke before. After the first stroke, they are fine, except they might have a little bit of weakness on one side of the body, but they still functioning well. Their brain, has very intelligent mentality, and they can respond to questions really fast and very effectively. But unfortunately, if they have like a second stroke or first stroke, and then, you can tell that cognitive function actually decline rapidly. In some cases, because they are suffering from a type called as vascular dementia. The people who have multiple stroke in their life, and they might suffer from vascular dementia. And this category contribute about 25% of the total number of dementia patients. And then, we have some other much rare dementia type, such as dementia with Lewy bodies and frontal temporal dementia. And there's a whole long list at the next page. Okay, we have dementia caused by normal pressure hydrocephalus, Parkinson's disease. We have dementia caused by STD, including syphilis, HIV. Of course, people with family history of dementia, they have a high tendency to get dementia. And something, we need to pay more attention is in certain patients, they have deficiency in some kind of vitamin and they get dementia too. So we have to make sure, when we seeing the patient with symptoms of dementia, we have to check, whether they have any vitamin B deficiency. And brain tumor, of course, if somebody get a brain tumor growing in the brain, they might get into dementia. Low function of thyroid gland, not getting enough secretion of thyroxine, they get dementia too. Heavy alcohol user, they might suffer from dementia when they have drank enough for years and years. Metal poisoning, and there are two more on the right column here, as you can see. Chronic hypoxia. I want to expand a little bit about chronic hypoxia. That means, we are not getting enough oxygen all the time. One condition we have to pay more attention is, we call it sleep apnea. A lot of people, they might have sleep apnea and they stop breathing in the middle of the night and they don't even know it. And if they suffer from long enough of time, they might have dementia. So we have to be careful. So if you have a lot of loud snoring, or your spouse notice that you might have a very noisy snoring at nighttime when you sleep, or you might have noticed that you stop breathing in the middle of the night, then you better tell your doctors. So the doctors can do some tests, make sure you don't have like sleep apnea. And the last category is traumatic brain injury, such as, people playing like football, boxing, and that increased chance of getting chronic brain trauma. And that can end up with dementia too. So those are the really rare causes. And as I said, the major cause is Alzheimer's disease and vascular dementia. Okay, when the patient comes to my office, I have to make a diagnosis of dementia. Then we can start off the treatment later. And usually when they come with their spouse, the spouse always complain, you say, oh, Dr. Chang, something wrong with my husband. He is not right. Check him out. I would say, what's wrong with him? And then, the wife said, he is very forgetful. He can't even remember, the kid's name. So that really light up something. We have to be very careful about that. We need to get a good history, from the spouse or from the patient himself, and just see what kind of problem they have. And the next test I would do is do a short-term memory test. That's a very useful, but it's a very simple test. I usually would, give out 3 items, such as an orange, a pencil, or name a car, and ask them to remember that and test them in about 5 minutes. Some patients can reproduce all 3 items without any problems, but some patients might end up with 0 answer, so that is very alarming. If the patient cannot answer any one of the 3, it's very high chance they already got dementia. The next test I would normally do is ask them to do a little bit of drawing. The most favorite test I would like to do is ask the patient to draw a little watch and tell them, what time you expect them to draw. Such as the one on the right side, I ask my patient to draw a clock with 11 o'clock. As you can see, he did do a little circle there, but it's not 100% perfect. But he did a circle, but unfortunately, the 2 arms of the clock are pointing in correct position. So by doing this test, actually we can test a few things, on the patient. Number 1, we test whether the patient can listen to the instructions, whether he can understand your instruction, drawing a clock, okay? Number 2 is you're testing his hand drawing skill, whether he can draw a clock, his handwriting, whether it's good or not, okay? Number 3, you can test whether the patient understands what you mean by 11 o'clock, okay? So a lot of things actually, just by asking this simple test, you can test on the patients. And then, we have more tests already used, for years and years, such as MMSE, that involve a lot of questions in the test, at least 18 to 20 questions. And then the 6 CIT is a more simple test. You ask simple questions such as what time is it now? What day is today? Where you are, Those are the tests, you test for dementia too, okay? So after all this, detailed history of the patient and the simple test, you already can judge whether the patient have dementia by 70 to 80%. And then you order some image studies, such as CT scan or MRI or PET scan. The function of those tests are, you want to test whether the patient have a brain tumor, right? We talk about that. Some people have reversible dementia. If it is a brain tumor, you can go for a surgery, and then you remove the brain tumor there. And hopefully the patient have better mental function after that. And of course, another test you need to do is a blood test. You want to check for the thyroid functions, make sure they have adequate secretion of the thyroxine from the thyroid. You want to check for a vitamin B, make sure they don't have B12 deficiency. And you want to check for the kidney function, liver function, because sometimes that affects their mental function as well. So those are the basic things you need to do before you jump into the diagnosis of dementia. As I said earlier on, Alzheimer's disease is a major type of all dementia, right? Let's go through the symptoms of Alzheimer's disease. In fact, the disease describing here is very similar in other forms of dementia. So keep in mind, those are the main symptoms of dementia. Number one is the memory failure. When you come to a patient with dementia, the very first symptoms they might be having is loss of memory, especially the short-term memory. What we mean by short-term memory is, the recent memory. Say what they have for the breakfast on the same day, they cannot reproduce it. Oh, they keep thinking, and they cannot tell you what they had in the morning. Or the day before, what did they do? Did they go out to have a walk? They cannot remember that. Okay, so we are talking about short-term memory, and that is the most common symptoms for dementia patients. Why is that? If you look at their brain, if you do an autopsy of those early dementia patients, you see there's a degeneration of the hippocampus area. As we mentioned in the photo, a few slides beforehand, and you can see there's an obvious shrinkage or degeneration of that hippocampus area. And the hippocampus area is responsible for our short-term memory. Okay, the next symptoms dementia patients may have is decline in their language. They might able to speak some full sentence, but sometimes they're not able to name an object, okay, such as like a pen. They look at the pen, they can describe it, but they cannot name it. Oh, this is a pen, okay? So they have difficulty to find words. And other symptoms such as decline in reasoning and the thinking skills. Before the dementia happened, they might have very good, very intelligent thinking. I have a very good example for you here. An old lady, actually, she used to be a good learner. When she looked at, those TV shows, how to cook like a great dish, and she had no problem to it. But recently she said, oh, I cannot understand what they're saying on TV. Even I tape it, I look at it again, but I still don't get it. So, this particular lady have very obvious decline in their reasoning and thinking skills, okay? And some dementia patients have decline in the movement as well, especially patients with Parkinson's disease, and they also develop dementia. Those groups are very obvious decline in movement skills, and they tend to be more slow responsive, and some patients might even have personality changes. Some people may be very gentlemen in the past, but they become very bad temper, and they even, always have bad temper, impatient to anything, So some personality change may trigger the alarm that you have to look for dementia as well. Delusion and depressions, sometimes patients with moderate to advanced dementia, they may develop, depression and delusion because they think, they have a lot of limitation to do certain things. Sometimes they are very depressed because of that. Okay, some family members actually have a lot of concern about dementia. Say a daughter bring, her mom to my office, she concerned about her mom, having dementia. So I asked about the history, and I eventually find out her mom doesn't have dementia. She only has like normal aging. But how to differentiate the normal aging and the dementia sometimes can be difficult. And I create a table here to help you guys to learn about normal aging and dementia. On the left is normal aging, and on the right side of the table is dementia. The first one on the left forgets something but remembers later. Okay, let me quote an example, then you'll understand it better. Let's say an old lady, she goes out from her room to the kitchen, and she's trying to get a cup of water. So by the time she gets to the kitchen, she totally forgot about it. Oh, what am I doing here? I supposed to be in my room. And then she go back to her room, and then her spouse remind her, what's going on? You're supposed to get a glass of water. Why are you coming back without that? And then she remember, oh my goodness, I supposed to get a glass of water. She recall all the memory. She remember it later. So that may not be dementia. That may be just a normal aging. Okay, let's look at the table on the right. Maybe the same lady, she goes out for a glass of water, and then She went back in. Her spouse, remind her, oh, you're supposed to get a glass of water. And then she said, no, I did not remember that. I'm not. Well, she even refused after people remind her. So this is something alarming. She might have dementia. Okay, so we have to differentiate normal aging and dementia. Sometimes it can be very difficult. Even doctors find it difficult too. So we have to get more information and see which category the patient falls into. Okay, let's talk about the different staging of dementia. And we have 3 different stages. Okay, the first stage is early dementia. Sometimes, patients with early dementia, they may not have any severe symptoms. The only symptoms they may have is like a memory impairment, especially the recent onset memory. Okay, as you see on the picture on the right side, the hippocampus area, which is the area responsible for like short-term memory. Okay, so for the early stage of dementia, people will have some degeneration of this particular area, and that mainly affect the recent memory. It takes about 3 to 4 years from the beginning of dementia to like middle stage of dementia. During this stage, the area got affected in the brain, not just the hippocampus, and it spread to other areas, such as the language area. So the patient might have difficulty in verbal expressions, and they may even have long-term memory impairments, okay? The patient might have not just degeneration of hippocampus, the degeneration might spread to other parts of the brain. They might become more slow in response, they might become more emotional, and sometimes they might even have some psychotic symptoms such as hallucinations, including the visual hallucinations or the hearing hallucinations. And a lot of time during the middle age of dementia, the patient might have some problem to differentiate whether it's a daytime or nighttime. They're so confused about the timing. That's why they might try to go out from their home during the middle of night. And a lot of them may get lost on the street. And as you can always notice, from the TV news, and they always say, oh, Mr. Jones, get lost, as reported by the family. If anyone noticed and any sign of Mr. Jones, please report it to the police. And a lot of people with dementia, they get lost on the street. I have experience with one of my patients. He sneaked out from his home, in the middle of night. Actually, where he went to. He went all the way up to the freeway, and nobody knows how he get there. But he was found on the freeway. That's a very dangerous thing, And you might bump into like a car accident, or you might bump into like some really bad guys, and they might rob everything you have, and they might injure you on the street. So we have to make sure they have enough protections, especially the family members, have to really keep an eye on them like 24 hours a day, make sure they don't go out by themselves. From the beginning, all the way until the late stage of dementia, it takes about 8 to 10 years, but it varies, in different individuals. And by this time, basically the whole brain gets affected. And the patient might have very severe symptoms. They have very difficult on the speech. Whatever they say, the family members may not understand. And they can't recognize their spouse. They cannot recognize the rest of the family members, especially the grandkids. They always get their name wrong. And they might become incontinent. They have to wear diapers. And some of them might even have swallowing problems. That's why they have a lot of weight loss. And they have a lot of limitation on their ambulations, and they can't even walk, and they become like bedbound, and they sleep in bed most of the time. And some patients' family ask me, Dr. Chang, what are the leading cause of dementia? And most of the patients of dementia, they die of like infections, especially like a pneumonia or urinary tract infections, because they have inadequate nutrition, and their immune system is suppressed, and they lie in bed most of the time, so they are more prone to like a pneumonia. So that most likely is the leading cause of dementia. Okay, we're going to talk about the causes of dementia. And we feel very bad, even we have a very modern medicine nowadays, we don't even know the causes exact causes of dementia. But we found something very interesting in dementia patients. When we do like autopsy of the brain of dementia patients, we found out there are two different kinds of protein that exist in majority of cases. And the number one is the beta amyloid proteins. The beta amyloid proteins, they tend to come together and they tend to form like different plaques that can disrupt the nervous system and make the brain cells die prematurely. And the other protein, which is very common too, named as like a TAR protein. Again, they form a lot of tangles. They tangles up, among the brain cells, and that actually, again, kill up a lot of brain cells, and that the patient end up with dementia. So those two proteins are very common in dementia patients. But unfortunately, we still don't have like a diagnostic method to detect them before they end up with like a very advanced dementia. We are working on it. A lot of research are doing it. Hopefully, we can finally get some kind of test. We can test out, the two proteins well before the patient develop dementia. That would be a really, really great achievement. We have a number of medications that can help dementia patients. And there are mainly two groups. The first group is the cholinesterase inhibitor. And the most common medication for this group is Aricept. This medication is very popular in USA, in Europe, and even in Asia. And what does that medicine doing is they increase the concentration of acetylcholine in the brain. As we know, the acetylcholine is the transmitter of the neuron cells, in the brain. So if we can increase the concentration of that, we might help the dementia. We can help try to preserve the memory function of the patient. The second group of medication we're going to talk about is Memantine. The most popular medication for this group is Namenda. This medication is mainly for the moderate to severe dementia. Pretty much for the early onset of dementia or early stage of dementia, we use the Aricept in the first group. And for more advanced dementia, we can try to put them on Namenda. And sometimes, patient might benefit from the combination of two medications. And there are, other medications that help the dementia patients, especially when they develop the complication from dementia, such as insomnia, depressions, delusions, or anxiety. Those medicines are pretty much aimed for helping those symptoms. So beside the medications, we can help the patients for dementia with some non-medications treatment. Okay, those are the non-drug therapy, okay? And we're going to go through all this therapy very briefly. The first one is the behavioral therapy. If you know psychology, I'm sure you understand what behavior therapy means. We always try to use some reward to enhance some good behavior. And we use the punishment to diminish some bad behavior. Let me give you an example. Let's say an old lady, she always try to sneak out from home in the middle of night. And her daughter need to educate her, please not to go out in the middle of night because it's dangerous. If you don't go out in the middle of night, then I will bring you for some dim sum. So that is something she really likes. So you try to enhance the behavior, try to avoid to have her going out in the middle of night. So you present it with a reward, and hopefully that will help her to correct her behavior. That is the principle of behavior therapy. Okay, so it's very straightforward. And the next one is cognitive therapy. During this therapy, we try to preserve the cognitive functions of dementia patients. The therapies can do a lot of cognitive training on the computer nowadays, and just by practicing all this computer software, the patient can kind of preserve the cognitive therapy, the cognitive function a lot. Music therapy, that is pretty much like self-explanatory. You're playing a lot of music, soft music to the patients, and that can help their anxiety, that can help the depressions. reminiscence therapy. Okay, that is another therapy the therapists like to use a lot. Patient can get a lot of satisfaction, increased ability to communicate, increase the self-worth of belonging by sharing their old photos, their old belongings. So that really help the patient a lot sometimes. Aromatic therapy, there's another therapy a lot of therapists like to use is they try to give some essential oils to the patients, and that can help the patients for treating all their symptoms, including the anxiety, insomnia, or even improve their memory. Sensory therapy is an effective method for, once again, reducing the anxiety, calming the nerves, and providing comfort. It can be as simple as like a hand massage with some lotions, or listening to favorite music. Pet therapy, I see a lot of patients in the elderly, in the nursing home. When I go to see them, sometimes I bump into people bringing in a lot of pets. The pets actually can help a dementia patient to be more interactive when sometimes they are not able to do so in social setting with like other adults. The pets can help them. It can reduce the anxiety, reduce the agitation, depression, and the loneliness. Bright light therapy. There are many dementia patients have sleeping problems, and as a result of that, they have difficulty in maintaining their daytime functions. So the recent studies show that a lot of people may benefit from bright light therapy, and that help them to sleep better at the middle of night. Okay, so basically, all 8 types of therapy and helping to preserve or maintain the dementia patient's functioning and their independence. But one of the many key points is the family members, play a very major part in taking care of patients. They need to have a lot of love, patience to their family members, so that that can help the patient to live like longer and have a more independent life. Okay, come to the very last slide. I will give you some tips about how to prevent dementia. And those 9 points here are all evidence-based. They are proven to be effective. The first one is apple. Okay, it's very simple. And Chinese always believe, eating an apple every day and you can keep away from your doctor. That is very true. And they find out apple, has a special function of preserving people from getting dementia. They do a lot of studies, especially on those rats, and they give one group of rats, with apple juice every day, and the other group with just plain water. And after a certain period of time, they found out, the rats who drink apple juice every day, they are doing much better in terms of their mental functions. So apple is definitely is a good add-on for patients who want to prevent from getting dementia. And the second one is curcumin. Okay, curcumin, how we find out curcumin is effective in dementia. Doctors, notice that people in India, they has a very less chance of getting dementia. The incidence of dementia in India is much lower compared to the rest of the world. So they try to look into their diet, and they found out the curcumin is a very popular material or food inside the Indian curry. So they do a lot of other research as well. Some, researcher at UCLA, they publish a number of papers talk about curcumin. So they found out the curcumin really have a role in preventing dementia. So nowadays, you don't have to eat a lot of curry in order to get curcumin. You can take the curcumin capsules. They do sell it in the drugstore, at the Costco, so you can get them easily, and you can take the curcumin on a regular basis. That will be very helpful. And the next one is regular exercise. Once again, exercise not just good for your heart, not just good for your lung. It's really good for preventing dementia as well. And more you can do is not just doing the physical exercise, you can also do some brain exercise. We call it the brain training. And you can use your brain more and more, and then you have a lower chance to get dementia. I think, the previous theory we had is totally wrong. We always think, in order to preserve your brain, you better use it less. But that is proved to be wrong nowadays. And in order to get, to prevent dementia, you need to use your brain as much as you can, okay? Such as playing mahjong, playing cards, or learning a new language, and that all helpful to prevent dementia. So, the simple recommendation is use your brain as much as you can, okay? And the next one is stay positive, okay? We don't have to be in miserable mood all the time. You have to keep everything positive, keep our mind positive. That will help, not just for dementia. That will help in terms of helping boost up your immunosuppressive immunizations, okay? That helps you to protect from all the bacterial infections. Expose yourself to sunshine, that will replenish your vitamin D deficiency, and that will help to prevent dementia as well. Higher education, as I mentioned in the very first couple of slides, country with high social or salary pay, they get high education level. In other words, they have less, people get dementia. That's the reason behind it. So as people in America here, people are getting a lot of good opportunities to get higher education. And that's why the dementia population in USA is relatively low comparing to other low social class country here. Adequate sleep is also important. We talked about vascular dementia before, and as we know, vascular dementia is a result of multiple and recurrent stroke. And by controlling the blood pressure, cholesterol, and the diabetes, we got less chance to get complication from the disease of stroke. So that indirectly helping out to decrease the chance of getting dementia. Well, that is all the slides I need to talk about. And now I would like to open up for Q&A.
Thank you so much, Dr. Chang, for sharing this valuable information on the topic of dementia, and also giving us some secret tips to prevent dementia as well. If you like this video, please share and like, and most importantly, subscribe our channel.